Every 45 seconds, someone dies from an antibiotic-resistant infection. That's over 700,000 deaths worldwide every single year. Superbugs are spreading faster than ever before. Common antibiotics that once saved lives are now completely useless against these deadly infections. Patients are dying in hospitals from infections that should be treatable. MRSA, Pseudomonas, and Acinetobacter, these bacterial killers are becoming unstoppable. Traditional antibiotics fail completely when patients need them most. But there's one powerful combination that doctors rely on to fight these deadly superbugs. Cefoperazone plus Sulbactam. This isn't just another antibiotic. This is a specialized weapon designed to destroy infections that resist everything else. Today, you'll get the complete medical guide to this life-saving combination. Everything about how it works, when it's used, and the critical safety information you absolutely must know. Whether you're a healthcare worker or a patient, this knowledge could literally save your life or someone you love. Whether you're a doctor, nurse, or healthcare professional treating resistant infections in your patients, or you're a patient or family member who's been prescribed this powerful medication and wants to understand exactly what it does, this video is your essential, comprehensive guide to making informed decisions about your health. I've spent hours reviewing the latest clinical research, FDA guidelines, international medical databases, and real-world hospital data to bring you the most accurate, up-to-date information available. This isn't just another generic medication video. This is evidence-based medical education presented in clear, understandable language. In the next 8 minutes, we'll cover absolutely everything. What this drug combination actually is, how it works at the molecular level in your body, why it's so effective against resistant bacteria, the specific medical conditions it treats, exact dosing protocols, proper administration methods, and most critically, every single side effect you need to monitor. Plus, I'll share the potentially life-saving safety information that every patient and healthcare provider must know. Cefoperazone plus Sulbactam is a combination antibiotic medication containing 2 active ingredients working together as a specialized team. Cefoperazone is a third-generation cephalosporin antibiotic. Think of it as the main fighter that attacks bacteria directly by targeting their cell walls. But here's the critical problem. Many dangerous bacteria have become extremely smart. They produce special defensive enzymes called beta-lactamases that can break down and destroy antibiotics like cefoperazone before they can work. That's where Sulbactam becomes essential. Sulbactam is a beta-lactamase inhibitor that acts like a protective shield, preventing bacteria from destroying the cefoperazone. Here's exactly how this combination destroys bacteria. Cefoperazone binds to specific proteins in the bacterial cell wall called penicillin-binding proteins. When cefoperazone binds to these proteins, it stops bacteria from building and maintaining their protective cell wall. Without a proper cell wall, bacteria cannot survive and die immediately. Meanwhile, Sulbactam ensures bacteria cannot fight back by producing defensive enzymes. It's a 1-2 punch that resistant bacteria simply cannot escape from. Cefoperazone Sulbactam is a prescription-only injectable antibiotic reserved exclusively for serious, life-threatening bacterial infections. Doctors prescribe it when other antibiotics have completely failed or when dealing with particularly dangerous, multi-drug resistant bacteria. This is hospital-grade medicine for critical situations only. The primary use is treating severe respiratory tract infections, including bacterial pneumonia caused by resistant organisms, hospital-acquired pneumonia, and severe sinusitis. It's highly effective for complicated urinary tract infections, serious kidney and bladder infections that can be life-threatening if untreated, especially those caused by resistant Pseudomonas and Acinetobacter species. This medication is crucial for surgical site infections that develop after major operations, intra-abdominal infections, blood poisoning called septicemia, and other severe systemic infections. When patients develop sepsis, a life-threatening response to infection, this combination is often part of emergency treatment protocols. What makes this combination special is its remarkable effectiveness against multi-drug-resistant bacteria that have developed complete resistance to multiple other antibiotics, making it a true last-line defense. This medication is only available as an injection and cannot be taken by mouth under any circumstances. It must be given either intravenously through an IV line or intramuscularly as a deep muscle injection. Administration must be performed exclusively by qualified healthcare professionals in a hospital or clinical setting. This is absolutely not a medication you can self-administer at home. The medication comes as a sterile powder that must be mixed with sterile water or saline solution immediately before injection using proper sterile technique. Standard adult dosing is typically 2 grams given intravenously every 8 to 12 hours, depending on the severity of infection and patient response. For children, dosing is calculated based on body weight, usually 50 to 100 milligrams per kilogram of body weight, divided into doses every 8 to 12 hours. Your doctor will carefully adjust the dose based on your kidney function, liver function, the severity of your infection, and how you respond to treatment. Treatment duration typically ranges from 5 to 14 days but may be extended for severe infections. Like all powerful medications, Cefoperazone Sulbactam can cause side effects ranging from mild to potentially life-threatening. Most patients tolerate it well, but you absolutely must know what to watch for. Common side effects include nausea, vomiting, and diarrhea, affecting about 3 to 5% of patients. At injection sites, you might experience pain, swelling, or redness. This happens in about 16% of intramuscular injections and 3% of IV administrations. Serious side effects require immediate medical attention. Severe allergic reactions can occur, including difficulty breathing, swelling of the face and throat, and severe skin rashes. If you experience these symptoms, seek emergency help immediately. This medication can affect your blood cells, causing dangerously low white blood cell count, low platelet count, or bleeding disorders. Pseudomembranous colitis is a severe, potentially fatal intestinal infection that can occur during or after treatment. Symptoms include severe diarrhea, abdominal pain, and fever. This medication can also affect blood clotting, leading to increased bleeding risk. Report any unusual bruising, bleeding, gums, or nosebleeds immediately to your healthcare provider. This medication should never be used if you have known allergies to cephalosporin antibiotics, penicillin, or any components of this medication. Patients with severe kidney disease, liver disease, or bleeding disorders require special monitoring and possible dose adjustments under strict medical supervision. Pregnant and breastfeeding women should use this medication only when the benefits clearly outweigh the risks, and only under the most careful medical supervision with regular monitoring. Throughout treatment, your healthcare team will continuously monitor your blood counts, kidney function, and liver function and watch for signs of complications through regular laboratory tests. You must complete the full course of treatment, even if you feel completely better. Stopping early can lead to dangerous antibiotic resistance and treatment failure, potentially making future infections untreatable. Important drug interactions exist, especially with blood thinners, other antibiotics, and certain medications. Always inform your entire healthcare team about all medications, supplements, and herbal products you're taking. This medication requires hospital-level monitoring and should never be used casually for minor infections. Cefoperazone plus Sulbactam is a powerful, potentially life-saving antibiotic combination specifically designed for serious resistant infections that don't respond to standard treatments. While it can be highly effective in critical situations, it absolutely requires careful medical supervision, continuous monitoring, and strict adherence to safety protocols throughout treatment. The most important thing to remember is that this medication should only be used under strict medical supervision for serious, life-threatening infections when other treatments haven't worked. Never request this medication for minor infections, and always complete the full prescribed course. This video is for educational purposes only and does not replace professional medical advice, diagnosis, or treatment. Always consult your qualified healthcare provider for specific medical decisions and treatment plans tailored to your individual situation. If you found this comprehensive information helpful, please subscribe for more evidence-based medical education content. Stay informed, stay healthy, and remember, when it comes to serious infections, proper medical care saves lives. PLZ is ko buhat aka sa krk lik du jo buhat zyda informative ho.